friends, I am Dr. Ritu Khanna, ERT consultant from Varanasi. PCOS is the most common endocrinological disorder which affects 6 to 8% of all women. It's of lot of concern as it's associated with abnormal GTT, increased risk of type 2 diabetes and hypertension. The incidence, yes, it differs with ethnicity, with environment, with nutrition and genetics. There is such a lot of varied presentation: acne, hirsutism, menstrual dysfunction, central obesity, hypertriglycerides, and sometimes anxiety, depression, or a poor self-esteem. They may be lean, they may be obese. It's just the visceral fat rather than the BMI which matters, and they have an intrinsic insulin resistance, and that's the key player. So the primary treatment approach is lifestyle modification, which includes diet, the exercise, and along with the weight loss, the first line therapy to ameliorate this insulin resistance. We need to advise exercise for around 150 minutes per week, which is of moderate intensity, and this exercise is going to release the happy hormones, and this may help to prevent the relapse of a depression, and absolutely necessary for a long-lasting weight loss. Even 5% reduction in the BMI is going to do wonders. It's going to improve the glucose dynamics and going to normalize the menstrual cycle. Restrict calories to 1800 to 2000 kilocalorie. A regular meal, the frequency and timing has to be very, very regular. Do not skip any meals because they're going to cause you to overeat later. Adjust the carbohydrates to about 25 to 30% instead of a 50%. Avoid all the refined carbohydrates and sugars in the processed food because they're going to cause higher insulin spikes and take little amount of fat. PCOS being a very chronic inflammatory disorder, the microbiome needs to be taken care of. The fiber content of the diet needs to be increased, and this will also not only prevent constipation, but it's going to allow the body to eliminate toxins and decrease the cholesterol. So PCOS is a changing paradigm, and therefore it needs a multidisciplinary approach, and that too with full dedication. Thank you.